Hi everyone, my name is Katie Schubert. I am a practicing critical care registered nurse and I have been for the last 8 years. I went right into ICU as a new graduate nurse and quickly learned the value of protecting my mental health. There's a plethora of research out there now that shows that critical care nurses are repeatedly exposed to extreme stressors and events that could be classified as traumatic. In fact, they are now calling the burnout rate of critical care physicians and nurses an epidemic. So I think this is a major call to action, and we need to start evaluating how we are helping these healthcare practitioners take better care of themselves. There was a university hospital study done here in the US that surveyed critical care nurses, and 81% of them had some level of burnout syndrome. 33% of them had severe burnout syndrome. But there is hope. There's a lot of research out there that's pointing to a mindfulness-based practice of some kind, whether it's a mindfulness-based movement, meditation, deep breathing, stretching, a walking meditation. There's research that's showing that these practices can significantly reduce not only burnout rates, but also symptoms of PTSD and moral distress. There was a study that I came across that studied critical care nurses prior to an 8-week mindfulness-based movement program. They measured their PTSD levels, which they all tested positive for PTSD prior to the start of the study. They also measured their serum cortisol levels prior to the beginning of the program. After the 8-week program, they retested the serum cortisol levels, and every nurse tested had a normalized cortisol result, and PTSD symptoms were either within normal limits or completely gone. Interestingly enough, they measured these nurses again at the 16-week mark post start of the trial, and these nurses continued to present with a normalized cortisol level, as well as either reduced or no PTSD symptoms. So I think there's something to be said for implementing a mindfulness-based practice with our critical care practitioners. I myself have found it extremely beneficial. It's a non-negotiable for me to have a meditation and journaling practice prior to the start of my workday. I do it before I even leave the house. It has allowed me to show up as a better nurse to my patients. It allows me to flow through my workday in a much more positive way, and I would like to think that I boost the morale of those that I work with just by me being more positive and more present throughout my workday. So if you work in critical care, or even if you don't, I strongly recommend trying to find what works for you. There's so many options out there for a mindfulness-based practice, whether it's a meditation app, or if you find that you can't sit still, even just going for a walk, playing some nice meditative music off of Spotify or Pandora or YouTube, maybe repeating some nice positive affirmations to yourself on your walk. Whatever you have to do to center and ground yourself prior to the start of your day, just that centering practice, that encouragement to yourself that you can handle what's going to be thrown at you that day is so beneficial as a critical care practitioner. So I encourage you to find what works for you, find what resonates with you, because if you find that thing, you're going to stick with it, and more practice over time is what's going to make a difference. So I hope you find some way to reach out to me and tell me how it goes, and happy meditating.